Hello, everyone. I'm Dr. Ioanna
I
Nixon.
am Dr. Vilma Pacheco Barcia, and this is Open Doors Podcast, two women scientists driven by curiosity, evidence, and compassion.
Hi, everyone, and welcome back to Open Doors, the podcast where we explore professional well being in oncology and beyond, one conversation at a time. On this podcast, we open doors to better leadership, healthier teams, and practical tools for a better professional life. Today's guest truly exemplifies this. Dr. Teresa Amaral, welcome. You're not only a highly respected medical oncologist, but a researcher and a very compassionate leader who has shaped the culture of mentorship and networking.
Dr. Teresa Amaral is a board-certified medical oncologist with a remarkable international career. She earned her MD and a degree in aeronautic medicine from Lisbon, completed her specialty training in medical oncology, and now leads translational research at the renowned Skin Cancer Center in Tuebingen, Germany. Her work focuses on cutting-edge biomarkers in melanoma, and she oversees numerous clinical trials while mentoring the next generation of oncologists and researchers. She has served as chair of the ESMO Young Oncologist Committee and now leads ESMO Leadership Development Committee. Teresa is not only an accomplished clinician and researcher, but also a passionate advocate for compassionate leadership, mentorship, and well-being in our profession. Teresa, it's an honor to have you here.
Thank you so much for the invitation. The honor is mine, and I hope I can inspire some of our listeners as well. Thank you.
Thanks, Teresa. Your journey has taken you from Lisbon to Tuebingen, studying with the Portuguese Air Force as well, and leading then cutting edge melanoma research in Germany. So, looking back, what did this diverse experiences teach you about resilience and adaptability, both as a person and as a professional?
Yes, that's a very interesting question. I never really thought about it, to be honest. So I think the two environments are very different from each other. But I think my background in the military actually led me to have more of a structured approach to things, and also to understand that if you don't communicate clearly, the chances for people to make mistakes or to do what you don't expect them to do, it's very high. So this clear communication, it's very, very necessary, especially when you are I would say, in a dangerous environment, so to say. So this is something that I took even without knowing about that. But when I then kind of left the military and moved to another setting, this is what I see the most, that I really have the need to communicate clearly so that people understand my message, but also understand what I expect from them. And the other point is, when I moved to Tübingen, it was really a very humbling experience because I had already finished my residency. So I was thinking I know everything now, so I don't need to learn anything else because you are kind of the top of everything. You just did your exam. And moving to another culture was very difficult in the beginning, not just because of a different culture, but because you are far away from everybody that you know. So my family is still in Portugal. On top of that, I needed to learn a new language that I didn't know before. So I didn't know how to speak German. And this was the first time that I failed in any test in my life. That's when I did my test to my communication test in German, and I failed the first time, and I have never failed before anything in my life. So these two aspects, moving into another place where actually I would say I was allowed to fail because this was the first experience, but also coming from a very structured environment kind of modulated the way that I look into the teams that I work now at this time point. So being compassionate on the fact that everybody actually fails and it's not a problem, but also being very clear on the message that you pass, so that when people fail, we can understand where was the problem and deal with that in a positive way.
Wow, Teresa. And also, not many oncologists can say they trained in aeronautic medicine. So you had the language barrier after and so many differences. I imagine that world of discipline, teamwork, and safety checks is quite different from hospital life. So you've mixed both sides Are there any habits, Teresa, or mindsets from your time in aviation medicine that still shape how you work in oncology today?
Yes, definitely, definitely. First, I'm a person that actually wakes up very early. So this is something that I still get from the military. It's again this structure of clean and clear communication. So this is one of the most important things that you have when you are in a military environment. So you need to communicate clearly. But on the other side, what I try to bring to my team is also this spirit that we had when I was in the military and when I was in the Air Force Academy. That actually you felt that if you would stay behind, somebody would pick you up.
Mhm.
So nobody would, and it was literally nobody would be left behind. And in some cases, you need to transport the person physically. I would say that in oncology, you don't need to transport the person physically, but it's important that the people that are in your team understand that you will not leave them back or you will not leave them behind. And sometimes it's difficult to conciliate with your own objectives and the things that you want to do because you have different opinions and different timelines in your team and people that want to do this or want to do that or need to do this or need to do that. And everybody needs to understand that even if they have different timelines or different objectives, the whole team will not leave this person behind. So there is space for everybody and you will be carried out regardless how we are going to carry this person out. So I think these are the two, let's say, aspects that are common to both professions. Definitely the discipline, it's one of them, and people say that I tend to give a lot of orders. Even here in the workshop, people are very impressed by the fact that I kind of want things to be done on time or things to be done in the time that we want it to be done. Not so flexible on that because I think you also need to respect the time of other people, right? If you have 10 minutes to speak, you should keep your 10 minutes. Don't talk 15 or 20 because the other people's time is also important. And I think this really shaped the way that I try to bring the teams together. So these two aspects, so structure, flexibility in some time, but support, and then clarity of communication. I think these are the points indeed.
That's amazing. Thank you for sharing. And all these skills that you described are transferable and can be taken into all aspects of life, including in oncology, medicine, and any other aspect of life, really. And I love the fact that you touched on the importance of trust, not
Mhm.
leaving someone behind, having the trust that your team is going to look out for you. Autonomy as well, being able to do things that you want, respecting the alignment with the team's objectives or the organization's objectives, and the fact that you value clarity through clear communication. I think all these three are fundamental for leading a very efficient team that can thrive. So moving between countries, Teresa, and I can completely resonate because I was born in Greece and I live in the UK. So my journey started from London and then I moved to Scotland. So I can completely resonate with you. In terms of building research at the same time and dealing with all these changes, what is a practical advice that you can give a younger colleague who is training, has got a lot of dreams, they want to be involved in research, and they live abroad? Any practical advice to these colleagues?
Yeah, so my practical advice would be to also be clear on what you want to do, because sometimes we, and maybe start small, think big but start small. So we move away from our country, and I think this is the first big move, not physically move, but the first big decision from in your life. So I think once you have moved, if you have moved once, moving twice or three times, it's not that difficult. The first thing is when you move the first time, right? Because this is cutting with everything that you know that is familiar to you. And we go with a purpose. So you don't go just to move, you go because you want to do something different from what you had in your country or what was allowed for you to do in your country or what was the possibilities. And we have very big dreams on what we would like to accomplish, and sometimes in a very short amount of time. And this can be really disappointing when you don't get what you are thinking about. So my advice would be to think big in the big picture, but also to start small on the projects that you can do. If you are doing clinical research, start with a small project with very clear objectives and try to finish it. And show the people that work with you that you are able to start and finish something. Because the thing that I know that I'm looking into also people that do the same thing that I did and come to me and to be trained in the center. This is what I look for. If somebody comes with a very big idea with a lot of projects, but they don't start three or four, but they don't finish any of them, then it's very difficult for you to actually keep on wanting to work with this person, because you see that it's not going anywhere. So if you want to gain the trust of the people or the person that actually allowed you or brought you to this new country or this new team, you need to show that you can do whatever. You need to show that you can deliver what you are asked to deliver. So my advice to these colleagues is really to focus on small things that are feasible, that show your commitment, that you are responsible, that you can do what you tell people that you want to do, and then build on this foundation to have bigger projects and to have bigger collaborations. What I would also suggest is that you try to find some people that are in the same situation that you are, either in your institution or in the city that you live, because it can be very, very lonely, and it's always better if you find somebody that you can talk with. So try to look into both sides, not just work, because this is important, but if you don't have a supportive person or more than one that actually supports you through all these difficulties, even if you are successful in work, I think it will not be completely fulfilling. So this would be my two practical advices.
Wow, it's amazing the power of collaboration. You've explained it perfectly. I think your advice is wonderful. It's powerful. Sometimes we want to do big things, which we can achieve, but we need to work on them little by little and always with support. And speaking of navigating worlds, one thing that really stands out about you is how well you connect with people, no matter where you are. I mean, what you've said about collaboration, I think it's a powerful message because we should never forget how important we are for each other in our teams, in our work. If we want to do a project, for example, when we wanted to build this podcast, Ioanna and I always say it's so important we have each other. Every small project, it can always win with a collaboration. You've spoken at conferences across continents, chaired key committees, and built a strong professional network in oncology.
So, yeah, absolutely. How do you approach networking so that it fuels you? You
Yeah.
get
So
energy. Yeah.
So I think that the one of the things with networking, and I actually, I don't know if it's by coincidence or not, but in the last couple of days I actually spoke about this at least 3 or 4 times. So networking with residents and other colleagues. So not speaking in conference, but I actually was approached with this point. Networking is something that you cannot put in your CV, because you cannot put I did networking here, I did networking there, I didn't, this is not a point on your CV. But in my opinion, this is actually one of the most important aspects of your career, because networking not only leads you to know the people that you want to lead to know, but also allows you in the future, when you have some projects or some doubts or you need some advice, these are the people that probably will be helping you, because you met them at some point in your career, or you met you at a congress or a conference, or and these are the people that you will go and ask for advice. So even if this is not something that you can put on your CV, you should dedicate a lot of time to network. And it is a way. It works both ways. First, you will find colleagues that are struggling the same way that you are. So you understand that you are not alone. You are not, an alien, somebody that doesn't know how to do stuff. It's a failure, this imposter syndrome that, is just with me. Nobody else is doing these mistakes. First, you'll understand that there are a lot of people that are going through the same thing. And second, you will also be able to help people with your own expertise and your own experience, because they will see you, or they will ask you for advice because they see you, I don't know, as more senior or somebody that has an experience that they don't have. And for me, it feels like giving back to what I got at another time, and somehow I'm able to help them at some time point of their career or personal life with something that I lived before, and I'm able to explain to them and let them know that this is how I did it. In your case, it might work, but you can also try to do it differently. So this networking is probably one of the things that fuels me the most with energy to continue doing my work, because it reassures me that I'm not alone, that there are other people that are feeling the same and are going through the same struggles. And on the other side, it reassures me that I have already overcome many of these struggles. And by the way, I can also provide advice to somebody that is going through the same thing, that might be in another time of their career. And this is really, I would say, rewarding in general.
Yes.
Yeah.
Absolutely. And many of our listeners, Teresa, may feel anxious about introducing themselves to people they don't know, but they look up to, and they're more senior than them. I've heard frequently people saying, well, but they don't know me, or who am I to go and speak to this individual? What is your tip for making that first approach less intimidating?
Mm.
Is it in our mind that we should not be approaching others based on seniority or who they are, thinking we're not enough, we shouldn't be reaching out to them?
Yes, I think it's more in our mind than in the reality. But yeah, depending on who you are talking to, of course, there are people that are look more unapproachable than others, right? And we always look into their professional position so that we give them some kind of, I don't know, virtual importance on how this person is important or is not important, depends on how you see it. But we always look into the position, if it's a CEO or if it's a medical director or if it's the president of some society. You think, oh no, this person is unapproachable, and or I should not waste their time by introducing me. This is something that I used to think. And my impression is that most of these people actually want to be approached. So they want to listen to what you want to say or what you think you need to say. And they are eager to understand or to hear your feedback and to understand why you are approaching them. This is my first impression. The second is that even if you think this person is unapproachable, if you're just going to say, hi, this is my name, I'm doing this, I'd like to discuss this with you, most likely you will get a positive feedback, because people are not unfriendly. So if you are afraid of contacting somebody or reaching out to somebody, my suggestion would be, think about a pitch, I don't know, 30 seconds that you want this person to take as a message, and just rehearsal that in front of a mirror or before you go to talk to this person, so that you think, or that you lower your anxiety, because you already said this many times. And something that I also learned is that even if during the conversation you miss something that you want to say, and this works also for presentations, don't be afraid, because people don't know what you are going to say. Only you know what you are going to say. So if at some time point you forget about it, just go on, or just make a pause that might be very, very long in your head, but for the person that is listening, it's not that long, and just pick up on where you were. So it's really, I think, in our mind, we give the power, even if they don't have this power. I think we give that to them, and that's why they are intimidating. But most people are not like that and are very approachable. And if you don't have the chance to talk to them personally, which I favor, just drop them a line, because most people will actually reply to your email. So even if saying, I cannot help you, but this is the person that can help you. This is my impression.
Wow, this resonates so well with the BMD leader piece that says networking is about building a community, not a contact list. We need to be clear, be human, and start small. Just ask about their work. Just what you were saying, Teresa. People love to talk about what excites them, what we want to, when we're doing research, we love to share with our colleagues. What were your early experiences, though, of networking like? How did you develop this global community of colleagues and friends, Teresa?
So I never did it actually actively. I think it just happened.
Yeah.
Yes, I mean, I didn't need it I didn't meant to do it like this. I must say that I'm actually an introvert person, although it doesn't look like. I'm not a person that per se goes and communicate with people. So I needed to do that, and I needed to learn how to do that. And the way that I start to doing that is actually, as you mentioned, Vilma, to ask for people's interests. So I used to, and this might be a little bit too personal, but this is how it was. So I used to think that if I talk to somebody, I need to talk about me, because people don't know me. So this was, let's say, my chance to let them know me. But I realized that with time, that actually people like to talk about themselves and their interests, and you can pick up on their interests as well. But the way that you make people feel heard and the attention that you give to them while you are communicating, it's how they will remember your contact with them. So, and I think that's how I was able to, or that's how I build these connections in the end. I make sure that when I'm talking to somebody, I actually am present and I'm listening to what this person is saying. And I try not to look into the phone or try not to, do many things at the same time, and really get an interest in what this person is saying, and think about what do you want to talk about with this person. If it's something that it's not planned, okay, you just talk about what comes up. But if it's something, as we mentioned before, somebody that you actually want to contact and ask about whatever, then really genuinely listen to this person and ask back and wait for them to answer you and not interrupt them, and listen. I don't remember where I read that, but this makes much sense. Listen to understand. Don't listen to reply, because sometimes we are very eager to reply and to show how intelligent we are and how smart we are and so on. And we are not even listening to what the person is saying. We just are waiting our time to reply. And I think it's this closeness and this attention to people that probably will help you to bring your network and also to understand what you can do for them, because this is the networking is again a win-win situation. So you need to understand what they can do for you, but you need to listen to understand also what you can do for them. So I think that's a little bit how I did it, although I didn't even think about it in the beginning. But yeah, that's my impression how I did it. Yes.
That is amazing. And I know you spoke about active listening and listening to understand rather than resolve. And I think I probably will take you through the next question to the person likely saying that, which is Michael West, when he's describing the circle of compassion and compassionate leadership. So we've seen his publication at the BMJ Leader, and he also wrote the book Compassionate Leadership. And it's truly, truly core to staff well-being, and it affects positively patient outcomes. How do you practice compassion and compassionate leadership in our current healthcare environments that are full of pressures, um, obstacles, volatility, uncertainty, ambiguity, complexity, and so on?
Yeah, it's a difficult environment to be in a leadership position. It's also a difficult environment not to be in a leadership position. So I think it's difficult for both. I would say that what I mentioned before about listening deeply about and listening with the intention to understand and to it's really what you need to do, because if you are listening to reply, then probably it's not going anywhere. you should really be transparent on what you are trying to discuss or what you are trying to pass on in terms of message. I think this is very important, and to be clear why you are having whatever conversation you are having, because um, sometimes you enter in the conversation with the feeling that if you are going to be very direct, the person will not feel offended or will not do what you think should be done. So this needs to be very clear from the beginning, but you can be clear and being kind. So you can be direct and being kind. You don't need to be you don't be aggressive. You don't need to be imposing whatever you want for people to do. If you listen to them and if you are transparent and clear from the beginning, again, this clear communication, um, you will get people's attention, you'll get people's support. One of the things that I feel it is important to say is that this clear communication also leads to people understanding what is your vision for the team and what you expect them to do. And if you can do this very clear from the beginning, it doesn't matter if you are there or not, people will react exactly the same way, whether you are present or not. And if you are not getting this from your team, you need to definitely give them feedback. But you can be firm and you can be kind at the same time. You don't need to avoid these conflicts, but you need to do it in a way that feels comfortable for you, definitely, but also that you are sure that when you are addressing these, people are understanding what you mean about that. And just do a mental structure that works for you, and make sure that your team understands why are you doing whatever you are doing and what is the mission of the team, so that when you are not there, everybody knows and understands how this should work.
Yes, it's true that it depends on the environment you are. It's not easy. It's not never easy to lead a team and work together, keep collaborations. Discussions might come up, which is normal because when we express what we feel, it's normal that we don't feel the same. Everyone. Actually, I think that's the empowerment of a team, that each person of the team has a different opinion and are able to discuss this opinion and truly make an effort to grow together. But sometimes the environment can be not so favorable. Teresa, you don't always choose everything that surrounds you, like in your workplace, in your team. So, what would your advice for planting the seeds of a more compassionate culture across the whole
Mm.
team?
Yeah. So I would suggest that besides clear communication and transparency, that the person that is leading the team actually shows that they can talk to you, that people can talk to you. So approachability definitely is one of the characteristics. Also, you need to be willing to accept feedback, and I think that's something that it's difficult because. One of the things that I learn is that people are very averse to critics, even when they say that they like to be criticized or they like to receive feedback. It's very difficult to receive negative feedback, so you need to create a structure for you that you deal with the feedback that you are given to, and you can learn from you if you are a person that would like to receive this feedback on a one-to-one, or if you would like to receive feedback from the whole team at the same time, because your reactions might not be exactly the same. And ideally, you should not react badly if you are in front of the whole team. Accepting feedback, yes, but you need to understand what is the safe environment for you to accept feedback that actually leads your team members to give you feedback, but also for you to react to the feedback the way that you want to react, and that is constructive for the team. Yeah, that would be my suggestion.
Yes, and I think it should be implemented.
Thanks for that. And it takes self awareness, Teresa, to know exactly how you respond to feedback and what is the best structured approach to take